is Ms. Runner Yap, your student nurse from Davao Doctors College. And today, I am going to perform a complete bed bath. So bed bath is done to perform or help wash a patient who cannot get out of bed. You may give an entire bath or just help a patient to wash in certain areas. So now, the first thing to do is that to ensure the client's comfort and privacy, greet the client appropriately, introduce yourself, identify the client using the two identifiers such as her name, his or her name or birthday, then ask how he or she would like to call during the assessment. So now ask the client if he or she wants to urinate, then offer the urinal. Then don't forget to perform hand washing to prevent the spread of the microorganisms. Then explain the procedure to the client on how he or she can participate during the assessment. Okay, so now let's prepare the necessary equipment such as the basin with warm water, 42 to 46 degrees Celsius, the soap and the soap dish, the clean gloves, and the linens such as the bath towel, the bath blanket, the washcloths, and of course, this is the patient's gown. Then for the patient's personal articles such as deodorant, powder, lotion, comb, and the table for the equipment. Then don't forget for the laundry basket. Hello, ma'am. May I come in? So now it is important to ask the patient's consent upon entering the room. Hello, ma'am. Good morning. My name is Franz, your student nurse for today. So, may I know your name?
Okay.
When is your birthday? Is that okay that I'm going to check for your wristband? Okay. So, what do you want me to call you? Okay, so Althea, by the way, do you want to pee? Okay, so the procedure that I will be doing today is that we are going to do a complete bed bath. This is done to remove dirt from your body and of course for you to feel refreshing. So, is that okay with you? Okay, so as you can see, I've closed the curtain so that there are no other people who can see us because personal hygiene is a personal matter. So, let's get started. So now raise the bed to a convenient working height, then lower the side rails and assess the patient to the side of the bed. Place the bath blanket over the top of the patient, then remove the solid top sheet beneath and place it into the hamper. So now assess the patient's skin or other factors, then remove the patient's gown. If the patient has IV line or reduced mobility, begin on unaffected area. Okay, so ma'am, takilig ka. So, Althea, do you feel any skin problems such as itching or skin irritations? Okay. Okay, so now fill the basin 2 to 3 full of warm water, then check for the temperature. Then of course, let the patient check for the temperature of the water if he or she can tolerate it. Then remove the pillow in the patient's conditions allows. Then raise the head of the bed 30 to 45 degrees and wash the patient's face. Okay, so I'm going to get the pillow. So now place the towel appropriately. The first towel should be under the patient's head. And the second towel over the patient's chest. Okay, so by the way, Althea, can you tolerate the water? Okay. So now wash the client's eyes with water only, then dry them well. Use the separate corner of the washcloth for each eye. Then ask the client whether he or she wants soap for his or her face. So Althea, do you want soap to wash your face? Okay. Then wash, rinse, and dry the client's face, ears, and neck. Okay, so before doing the bath, make sure to use sterile gloves to protect yourself from the client. Okay, so Althea, I'm going to wash your face. Okay, so now this procedure if the patient is unconscious. Wash the eye with the plain warm water, starting from the inner to outer canthus, using the new section of each cloth or to each eye. If prescribed, instill eye drop or ointment. If no blink reflex, keep the eyes closed and close the eyes gently and place eye patch or shield. So wash the arms and hands. Expose the patient's forearm and place the bath towel lengthwise beneath the arms. Wet, soak, rinse, and dry. Then cover the arm and axilla from distal to proximal, then the hand and nails. Then now, let's proceed to the other side. Now, washes the chest and abdomen. Spread the towel across the patient's chest while lowering the blanket to the umbilical area. Lift the bath towel off the chest and bath the chest and abdomen using your mitted hand using long, firm strokes. Then give special attention to the skin under the breast and any other skin folds, particularly if the patient is overweight. Rinse and dry well. So now if your patient is female, cleanse and dries the skin beneath the breast. and check and change the water if necessary. Drape the patient's chest and abdomen using the towel and the both blanket. So now I'm going to change the water. So now let's proceed to washing the legs and feet. Expose the patient's leg by folding the bath blanket toward to the other leg. Being careful to keep the perineum covered and place the towel under the leg. Wet, soak, rinse and dry the patient's leg from distal to proximal. Wash and dry the patient's foot thoroughly, then apply lotion. So now, reverse the coverings, then repeat to the other leg. So now, discard wash clothes and maintain patient's privacy. Refill the basin with the clean water. Change clean pair of gloves. Then apply perineal care as necessary. So now, with the new refill basin and new washcloths, the new pair of gloves, let's perform the perineal care. So now, the last part is to wash the back. Assist the client into prone or side-lying position, facing away from you. Place the bath towel along the side, back, and buttocks, while keeping the client covered with the bath blanket as much as possible. Wash and dry client's back, moving from the shoulder to the buttocks, and upper thighs, paying attention to the gluteal folds. So if the patient's skin is intact, remove and discard gloves. If used, then perform a back massage. Now or after completion of bath. Helps the patient to put on a new gown and check the device attached to the patient. Comb the hair properly, then place the signal device near to the patient. And does the aftercare of the equipment, then perform hand hygiene. So now I'm done doing a complete bed bath to my unconscious patient.